You guys good? All right, great. Good morning, everyone. First, I'd like to start by thanking everyone for coming and continuing to raise awareness about the pediatric mental health crisis. I want to especially thank Kohl's, not just for the gift that we're announcing today, but for their continued leadership in supporting the health of Wisconsin kids. We're here today because Kohl's generously donated $3 million to help Children's Wisconsin add 3 more mental health walk-in clinic locations around the state of Wisconsin over the next 3 years. The locations have not been determined yet, but the plan is to announce 1 location this year, with the first being announced in the fall. The services offered at these clinics will be similar to what we have here at the Craig Yabuki Mental Health Walk-in Clinic on our Milwaukee campus. Since this clinic opened to the public March of last year, our team has provided immediate support to over 1,000 kids who are experiencing a mental health crisis. That tells us that the need is great. About half of those families have come from Milwaukee County, which means half of them have traveled from outside of this county. Some have come as far away as Chicago and Manitowoc. The biggest concerns our teams have seen here relate to anxiety, depression, school avoidance, and trauma. And that's consistent with data that we see coming from the Office of Children's Mental Health. Their research showed that in 2022, anxiety, depression, and suicide reports were up, with 34% of Wisconsin students feeling sad and hopeless almost every day. That's a 10% increase over the last 10 years. We know kids in Wisconsin need more support. This gift from Kohl's will help us to invest in the right people, programs, and operational needs to better meet the mental health needs of our children. When Children's Wisconsin announced our $150 million commitment to pediatric mental health in 2019, we knew we could not do it alone. We knew it would take us partnering with organizations that share our values if we were really going to make the type of impact we wanted to make. From the very beginning, Kohl's was one of the first to join and say we want to help. In 2019, they committed $5 million to help us expand school-based mental health, introduce mental health screening, and support an awareness campaign to reduce stigma around mental health and mental illness. We can't thank them enough for being such great partners to us and to Wisconsin kids. It's our mission to treat mental health as health and to ensure that more kids in Wisconsin have access to the care that they need. These additional walk-in clinics around the state will help us take a huge step towards achieving that goal. Now I'd like to introduce Christy Raymond, the Chief Marketing Officer at Kohl's. Christy can share more about why this issue is so important to Kohl's. Christy, on behalf of Wisconsin kids, thank you to Kohl's for being such a great partner.
Thank you, Amy. Thank you so much for having us here today. Wisconsin has been home to Kohl's for over 60 years, and it's really important to us to give back and support our communities. We have been working with Children's Hospital for 20 years. The cornerstone of our philanthropic efforts is family and health and wellness, and Children's is a leader here in this space. They've been making an impact in our community for so long. In 2019, as Amy said, we gave $5 million and really wanted to focus on mental health. We know it's the epidemic of this generation and critical that we really make an impact. And then just recently, we also are donating another $3 million to expand this program, to open up these 3 additional facilities, again, across the state. We're honored to be working closely with Children's Hospital. I'm really thrilled that we're able to make this donation. Thank you.
Can you just say and spell your name and the title?
Christy Raymond, CHRISTIE RAYMOND. Oh, Chief Marketing Officer.
Thank you.
Yep.
You guys have any questions for them?
Sure, I'll ask them.
I'll answer it.
Why not?
Has there been a rise in this need post-pandemic or anything like that? Have you seen just a higher need for these services?
So I would tell you that prior to the pandemic, we knew that our kids were in the midst of a mental health crisis. And then the pandemic really further exacerbated those issues. And we saw, isolation really making an impact on our kids in a negative way. And they suffered during that period of time where they weren't doing what they would normally typically do given pre-pandemic times. So they weren't necessarily participating in their sports activities or their extracurricular activities or being able to socialize and engage one-on-one, face-to-face with their peers and their teachers and others in their life. And that really created a situation where our kids experienced even more anxiety and more depression. And we absolutely saw that there was an increase in need for mental health care during the pandemic and every day since.
But you said you kind of saw it on the rise before. Do you have any explanations for that?
Absolutely. So there's a few things that we think were happening that created this situation where our kids really were in this mental health crisis prior to the pandemic. One is that I think that, and maybe this is the main issue, is that we were starting to address stigma and we were starting to increase awareness. And so we were treating mental health like health and really beginning that journey. And kids have done a better job than parents in many ways talking about their mental health, whether they're doing well or not doing well. So I really believe that that was a positive reason why we saw this increase in need. And then I would tell you that there's some negative reasons why we think we saw that increase in need. Social media being one of those issues. Sometimes what you see on social media, it looks fabulous, but it's what you put together for other people to see. And that sometimes can put a lot of pressure on kids who can't always distinguish between what is reality and what's actually happening most days to what they're seeing in social media. So I would say that's one example of something that has sometimes negatively impacted our kids and why they started to experience some more of that anxiety and depression.
And then that's why the need for even more of these clinics to be accessible.
Absolutely. So if we are going to treat mental health like health, then we have to find the workforce to provide the mental health care to our kids that they deserve. And we're going to need to be available to them where they live and play. And it can't just be in one location. So now that we're able to add these 3 walk-in clinics around the state of Wisconsin, we can be more accessible to kids and families in their community, closer to their home, making it even easier for them to access that care.
Great. Well, the questions I got, you kind of went over these already. Like, what is the money going towards the 3 facilities? I mean, I guess just go over that again.
Sure, absolutely. So this gift from Kohl's, the $3 million, it will help us to hire the staff that we need to provide care to the kids in the walk-in clinic. So we will be adding staff to our team, therapists in particular, navigators as well, and they will be available in the local communities for immediate access to mental health care for kids.
Great, and that's how it will benefit kids?
Yes, absolutely. So in the continuum of care of mental health care, in Wisconsin, it is robust, and we are grateful to have everything that we have here. But one of the pieces that's often missing in local communities is access to urgent mental health care. And so this is going to help solve that need and fill that gap. So now families that might be experiencing an urgent mental health need, they might need to drive a distance to come here to our Milwaukee campus to get to the Craig Yabuki Mental Health Walk-in Clinic, or they might need to show up in their local emergency room because they are having a health emergency according to their definition, or they might need to wait. And we don't want that to happen. We don't want anybody waiting if they're having an urgent mental health care need. And we want to give them something that's more appropriate to what they need, which is urgent mental health care. And that's different than what families might want to access in an emergency room. That's where we want families going if they're having an emergent medical need. So this is what families have been asking us for. This gives them what they actually need instead of them trying to make work what is already in place. So this walk-in clinic here on our campus and the 3 that we'll have around the state really is what families have been asking for, and now we will be available to them to have immediate access to mental health care if they believe they're having an urgent need.
Great. Good.
Thanks.
Thank you.
Thank you.
Thank you guys. Thanks for
We'll send
coming.
out the press release too with all this.
Okay.
After I get back, so.
Great. Yeah, thank you.
Yeah, thank you guys for coming. Do you want any shots? They have some kiddos, like, it's a separate clinic that
Okay.
is housed back here during the
Are we
day.
allowed to film them?
Not the kids, but
Okay.
just